Welcome to our third patient education series discussing eyelid rejuvenation. Our topic for today is upper blepharoplasty. What is an upper blepharoplasty and what does it accomplish? An upper blepharoplasty removes the extra skin and possibly fat from the upper eyelid. In addition to the removal of skin and fat, a strip of the muscle that's directly under the skin is removed to better sculpt the eyelid crease. The surgery itself provides a more youthful eyelid, and if carefully performed, doesn't alter the shape of the eye at all. In cases where the lid appears heavy, the upper blepharoplasty allows the eye to appear more open. In certain cases, the excess skin interferes with the individual's vision when looking upward. Surgery may actually improve this loss of visual field. How is an upper blepharoplasty performed? The procedure may be performed in our office while you're fully awake, or if you prefer, in a surgical center while sedated. The excess skin along the upper eyelid is marked. This is an elongated segment of skin extending across the entire eyelid from the inner corner of the eye to the outer corner of the eye. The lower limit of the marking is the natural eyelid crease. The upper limit of the marking is based on how much extra skin you have. Care is taken to ensure that you can still close the eyes if the outline segment of skin is removed. Once the outline segment of skin is removed, a thin strip of the underlying muscle is then removed along the full horizontal length of the eyelid incision. Pressure is then gently applied to the globe to evaluate the need to remove fat from the upper lid 2 fat compartments. With pressure on the globe, any excess fat protrudes forward. If there's no protrusion of fat, then there's no need to remove any. If there is protrusion of fat, some of it is removed to prevent the upper lid puffiness. However, usually only a very conservative amount of fat needs to be removed because we don't want you to appear hollow. The incision, which runs in the eyelid's natural crease, is then closed with a non-absorbable suture that is removed within a week. Care must be taken to ensure that just the right amount of skin and fat are removed. Excess skin removal can result in the patient's inability to close the eyes, resulting in chronic dry eye symptoms. Excess fat removal may make the eyelid appear hollow. This result often makes the individual have a sunken appearance to the eyes. Patients often ask if there are any scars. The incision used to perform the surgery is placed within the skin crease of the upper eyelid. Although healing of any incision will result in a scar, the eyelid skin is very thin and consequently heals very well. It's extremely forgiving. In addition, the incision runs in the natural upper eyelid crease and once healed is usually faded and difficult to find. Again, thank you for joining us for our educational patient series. To learn more about upper blepharoplasty procedure, please visit our website, www.chicagoplasticsurgery.com. Join us for our future patient education series discussing lower blepharoplasty. Thank you.